And thank you all for tuning in to today's important discussion on the COVID-19 pandemic and LGBTQI plus communities, a call for action for government and multilateral donors. I'm Jessica Huber, and I am from the US Department of State, and I'm delighted to be here today. As we begin to see promising news and hope that the end of the pandemic is not too far off in the distance, we know that the public health emergency has been compounded by inequality and disproportionate suffering for marginalized communities, especially including the LGBTQI plus community. Today's panelists will give us a clear and compelling case for donors to continue to support during this complex emergency. Before we begin, I want to extend my thanks to the ERC co-chairs, Argentina and the UK, for preserving this important space for multilateral engagement, especially during this difficult year of pandemic. The ERC remains a valuable coordinating space for a coalition of states, multilateral institutions, private funders, and civil society. I'm deeply encouraged by today's attendance and would like to invite the governments. Could you please mute your mic if you just joined? Great, thank you. I am deeply encouraged. No, we still have a problem. Somebody needs to mute. Veronica?
Well, Veronica is an interpreter, so.
Well, okay. I'm not sure who just came off mute, but that's the problem. I'll keep trying. If you've just joined, please mute your mic. Okay, I think it's working now. Can I get some head nods? Yeah, okay. Okay, so I just wanted to say that I'm happy about how many people are on today's meeting, and we would like to invite governments on the call to please reach out to me if you would like to participate on the donor working group of the ERC. The US is happy to chair this working group as part of our membership to the Equal Rights Coalition. US President Biden issued an executive order on his first day in office on preventing and combating discrimination on the basis of gender identity or sexual orientation. In that executive order, it said people should be able to access healthcare and secure a roof over their heads without being subjected to sex discrimination. All persons should receive equal treatment under the law, no matter their gender identity or sexual orientation. This was followed up on February 4th with the presidential memorandum on advancing the human rights of lesbian, gay, bisexual, transgender, queer, and intersex persons around the world, which directs all US agencies engaged abroad to ensure that US diplomacy and foreign assistance promote and protect the human rights of LGBTQI plus persons. The State Department endeavors to protect LGBTQI plus persons from violence and abuse, criminalization, discrimination, and stigma, and to empower local LGBTQI plus movements and persons. Secretary of State Antony Blinken reaffirmed this commitment earlier this month when he said, "We will stand firm behind our commitments to human rights, democracy, and the rule of law, and we will stand up against injustice towards women and girls, LGBTQI plus people, religious minorities, and people of all races and ethnicities." Specifically, he said, the Global Equality Fund provides emergency assistance to human rights defenders and human rights programming support to grassroots LGBTQI plus organizations to catalyze positive change and draw its strength from the support and partnership of international coalitions of like-minded governments, businesses, and foundation. As the manager of the Global Equality Fund, I'm pleased to see this level of senior US leadership commitment to this truly unique international coalition that supports the human rights of LGBTQI plus people around the world. The Global Equality Fund partners have worked hard to be responsive to the community's needs by providing flexible support, extending project deadlines, and reallocating funds to be more responsive to the needs of the community during the pandemic. I look forward to learning more during today's discussion about how the Global Equality Fund and other donors participating today can remain flexible in our approach and continue to identify the resources needed for human rights programming, public health support, and emergency assistance to LGBTQI+ organizations and individuals in need. And I'm pleased to turn it over to today's moderator, Julie Dorf from the Council for Global Equality. Over.
Thank you, Jessica, and thank you to everyone for joining today. And thanks again, Jessica, for the incredible partnership that we've had with the Global Equality Fund at the State Department. My job today is to keep us going and to move the show on the road, and also to make sure that we stick to what our purpose is today, which is to really dive into how multilateral and other government donors have been responding to the particular needs of the LGBTI communities around the world during the COVID pandemic, and ideally to really get into sharing best practices and thoughts about how we can really address some of the inequalities that I think we've all seen. We put together a resource guide, which we'll send out to all the participants afterwards, just trying to pull together the studies and the materials that have been produced by all kinds of both government and NGOs around the world. And it was really an extraordinary long list from every part of our planet and our community, looking at the ways that COVID has impacted our communities in particular. And I say that because that is really going to be contrasted with the presentation we're about to see from the Global Philanthropy Project about how humanitarian aid has flowed during the pandemic and how it really has not. That's going to be the heart of our discussion, and it's going to be my job to ask questions and make sure that and to monitor the questions that are coming from the audience and make sure we stick to our goals today. First, let me introduce our panelists. Then we're going to see a pre-recorded brief presentation from the Global Philanthropy Project, and then we're going to have our discussion among the panelists, and then we will open it up to questions from all of you who are in attendance today. So that is the flow. So thank you very much to the governments of Canada and Argentina for joining our panel today. I'm going to briefly introduce all the panelists, starting with Cheryl Urban, who is the Director General for Economic Development at Global Affairs Canada. Cheryl's been with Global Affairs Canada since 2010. And as the Director for Economic Development, she leads the department's engagement with international financial institutions and policy in the area of economic growth and governance. Prior to this, Ms. Urban was the Director General of South America and Inter-American Affairs, where she oversaw Canada's bilateral trade, political and development cooperation with South America. And in this capacity, she was Canada's permanent rep to the OAS. Thank you very much for joining us, Cheryl. Cecilia Meirovich is the Director of Human Rights at the Ministry of Foreign Affairs in Argentina. She is a graduate of the National Institute for Foreign Service and has been the alternative representative for Argentina also at the OAS. And in that capacity, I just want to say was one of the key leaders for the OAS LGBTI core group during her tenure in Washington. From the NGO side, we have Midnight Poonkasetwattana, who is the executive director of APCOM based in Thailand. APCOM has been working in a multi-sectorial partnership with government donors, UN, other partners, and especially primarily with the community and civil society organizations that are working to promote SOGIESC rights, as well as alleviating HIV in the Asia Pacific region. Welcome all of you. And we hopefully will also have joining us from Uganda, Pepe Onziema, who is the program director for Sexual Minorities Uganda. And I'm sure that Synergi is working on connecting Pepe as we speak. Yes, okay. And Pepe's been working for over 20 years in our movement as a human rights, as a transgender human rights defender. Sexual Minorities Uganda, or SMUG, is an advocacy organization based in Kampala that works to support the LGBTI communities across Uganda. So welcome the four of you. We're going to start off, and apologies for the pre-recorded nature of this presentation, but we're going to start off hearing from Dave Scamell, who is a leader in the human rights and public health advocacy sector for many years, currently working for the Global Philanthropy Project. And I guess as I introduce him and the video, which is 6 minutes long, so please bear with us, we're going to see a set of slides. And I don't know, Stefano, you're going to make those slides happen. But the Global Philanthropy Project is a collaboration of 21 of the leading funders of the the leading private funders of the global LGBTI movement. And he is going to present the recent research on COVID funding and the LGBTI communities. I'm not sure what I'm hearing, but let's dive into that. And then immediately after, we will have our discussion, which is what to the material that will be presented. So Synergi, can you switch us over to the slides and to the presentation?
Yes. And, we hear your voice. Can you see the presentation, everybody?
Est-ce que vous pouvez tous voir la présentation?
Magda, we are hearing your voice in the main channel. Okay, sorry for this. Now we are going to start.
Into the pandemic, GPP conducted the COVID-19 Global LGBTI Funder Survey of the leading government, multilateral, and philanthropic funders of global LGBTI issues. The 24 funders who participated in the survey represented just under half of all funding awarded on LGBTI issues globally, and 4 in every 10 grants given in 2018. More than 80% of the LGBTI funders who responded to our survey said that many or most of their grantee partners had shifted focus from existing programs to providing services to reduce the spread of COVID-19 amongst their community. And the same number had shifted focus from existing programs to provide livelihood, shelter, legal assistance, or other forms of support to address the secondary impacts of the pandemic. LGBTI organisations have been able to do this pivot to address humanitarian needs, in part because of the flexibility of many of their existing LGBTI funders. Among the 24 LGBTI funders who provided us with their forecasted budgets for LGBTI grants in 2021, the total funding for LGBTI issues, excluding domestic US funding, is expected to increase by 20% from 2018 levels. It's important to note that the existing funders of LGBTI organisations, including the 24 who participated in our survey, are largely human rights funders and or adopt a human rights-based approach to their grant making. they're not from the humanitarian response field. Pre-pandemic, in recent years, there has been growing evidence around the specific impact of humanitarian crises and disasters on LGBTI communities, demonstrating how vulnerabilities of LGBTI people are exacerbated in times of crisis and can result in particular challenges in accessing services within humanitarian responses. As the global COVID-19 pandemic was declared in March 2020, the UN Office for the Coordination of Humanitarian Affairs released the UN COVID-19 Global Humanitarian Response Plan, which outlined a coordinated response for the international humanitarian system. There was very limited mention of LGBTI issues in the original document. However, by the time that the Global Humanitarian Response Plan was updated in July 2020, there had been significant documented impact of COVID-19 on our communities. And therefore, the updated plan provided more detail on how LGBTI people were a specific at-risk population. As of November 11, 2020, just over $6 billion had been committed by governments and multilateral donors, as well as private sources, to address the humanitarian impact of COVID-19 pandemic, based on data available from the UN's Financial Tracking Services database. Of the almost 4,500 recorded resource flows addressing COVID-19, only one explicitly described funding to support LGBT communities. As the project description for individual resource flows on the Financial Tracking Service database can often provide limited detail, we also undertook a review of the response plans, public documents and statements, and official website information on COVID-19 humanitarian response from the largest donors identified through the Financial Tracking Service. Among the top 5 donors, all of who are governments and who account for more than half of all humanitarian resources committing to addressing the impact of the pandemic, none explicitly identified LGBTI communities as a priority, vulnerable or at-risk population in their COVID-19 humanitarian response. A review of the top 20 recipients of humanitarian funding for global COVID-19 response, as tracked through the Financial Tracking Service, paints a similar picture. The exclusion of LGBTI communities as a priority population within COVID-19 response plans and public statements suggests that humanitarian resources pledged by the world's largest government and multilateral donors are not systematically or directly targeting the needs of LGBTI communities. And this has a number of implications that we talk about and investigate in the report. Already overburdened LGBTI organisations will be stretched even further as the pandemic continues on, impacting their capacity to be able to both advance human rights agendas, but also respond to rising anti-rights attacks. At the same time, this COVID-19 pandemic presents an opportunity to break down the invisibility of LGBTI issues within the international humanitarian system. However, this will require addressing humanitarian needs will require new skills and relationships for both LGBTI groups and funders, as well as humanitarian actors. I will leave you with 3 questions for this webinar to consider. First, what role will the ERC government representatives play in increasing their government's resources for addressing the humanitarian needs of LGBTI communities? Second, what materials and resources are needed to advance these internal dialogues? And third, how can civil society and philanthropy be effective partners and their perspectives centred in these discussions? Thank you all. Thank you to the organisers for organising the webinar, and I encourage everyone to visit globalphilanthropyproject.org to download our COVID-19 report and other research. Thank you.
Back to
Thank you. Thank you, Dave, and thank you, Global Philanthropy Project, for that important piece of research. I think it's a really helpful way to start our conversation, to just ground us in the realities of a very stretched movement, a philanthropic landscape where money is shifting priorities, and a global humanitarian response where only 1 out of almost 5,000 Is it possible that the French translation situation can get worked out?
Veronica, I don't know what's happening, but
Can you mute Veronica?
you are in the main channel.
Oui, c'est que quand j'entre pour écouter l'espagnol, il y a ça qui arrive. Il faut que j'écoute l'espagnol pour pouvoir interpréter vers le français.
On ne peut pas marcher comme ça parce que tout le monde, parce qu'il y a beaucoup de bruit. Vous devez peut-être utiliser
Pardon.
Okay. Nope, not yet. Not okay yet.
Puedes utilizar audífonos, porque es la única manera, si no que... Hello, Julie.
Are we good?
It seems we are good. Yeah.
Okay. Thanks. So we're going to dive into our panel. Thank you. It doesn't seem like we have Pepe yet, but we're going to start with Cecilia and with Cheryl. Cecilia, really, Argentina has been such a trailblazer in terms of addressing the rights of transgender people, both in law, but also in government programming. Last year, the new policy of 1% employment quota in the public sector was just an extraordinary move. Can you tell us some more about how the government is addressing the needs, particularly the economic needs of the trans community in Argentina and the LGBT community writ large before and during COVID? And then we'll start from there. Welcome.
Thank you, Julie. I'm supposed to speak in Spanish. Voy a hablar en español. ¿Me escuchan? ¿Está bien el canal? Okay. Bueno, muchas gracias por la invitación. Me pidieron que hablara en español para alentar la participación de gente de nuestra región. Argentina, como co-chair de la Equal Rights Coalition, agradece mucho esta invitación que permite también visibilizar las políticas y los desafíos que tiene mi país. Bueno, como ustedes saben, para Argentina los derechos de las personas LGBTI están dentro de la política de Estado en materia de derechos humanos. En lo que refiere específicamente a LGBTI, transversaliza muchas de las acciones que llevamos a cabo en el exterior. Es un tema, por supuesto, que es nuevo en la agenda, no tan nuevo en materia de política exterior, pero sí nuevo para transversalizarlo, es decir, no solamente incluirlo en foros multilaterales o en diálogos bilaterales, sino también en lo que tiene que ver en comercio y en otros temas que se manejan en materia de política exterior. Pero yendo a la pregunta concreta de Julie, para no extendernos más del tiempo que tenemos asignado, obviamente la crisis social y económica causada por el COVID-19 nos encontró, digamos, sorprendentemente no sin herramientas, pero sí sin preparación para poder hacer frente no solamente a los derechos, en poder solventar, digamos, ayuda para personas LGBTI, sino en general. Es una crisis que afectó de forma estructural a todos los países y a todo el mundo, pero en el caso específico de las personas LGBTI, por diferentes cuestiones que hacen a su situación, los afectó de una forma muy directa y desproporcionada con el resto de la población, al igual que otros grupos en situación de vulnerabilidad o históricamente marginados. En el caso de las personas LGBTI, lo que ha tratado de hacer Argentina, al igual como en otros grupos, pero específicamente LGBTI, es en diálogo con las recomendaciones de organismos internacionales y regionales, poder tomar medidas que vayan al núcleo de la problemática de las personas LGBTI. Cuando pensamos en personas LGBTI, en general, pensamos en personas que pueden tener algún determinado nivel socioeconómico, pero no pensamos que dentro del colectivo LGBTI hay distintas realidades. Y eso pasa en un país como en Argentina, donde hay cuestiones estructurales sobre todo que tienen que ver con, digamos, carencias y pobreza estructural, y eso hace que el abordaje tenga que ser un abordaje muy específico. En ese sentido, las medidas que se tomaron, en primer lugar, tuvieron que ver con garantizar la salud de las personas LGBTI, que tengan acceso a la salud. Ustedes saben que en Argentina la salud es pública. De todas maneras, con el cambio de gestión de gobierno, la gestión anterior de gobierno no contaba con un ministerio, entonces justo fue el momento en el que se jerarquiza también el Ministerio de Salud. También pensar en que las políticas tuvieran foco en la inclusión de las personas. Las personas LGBTI, como decía, dentro del colectivo tienen diferencias, pero por ejemplo en el caso de las personas trans es un sector que está excluido del mercado formal en general, y al haber una situación de cuarentena esas personas no podían trabajar, y eso generó que tuvieran necesidades alimentarias, necesidades de vivienda, necesidades de todo tipo. Entonces hubo que tomar medidas que ahora las voy a contar puntualmente respecto a las personas trans. Y después, bueno, más específicamente establecer protocolos de salud, ¿no? Porque con toda esta emergencia sanitaria, las personas LGBTI también tienen necesidades especiales respecto a la atención, y sí, a través de todo nuestro sistema de salud se establecieron protocolos específicos en atención de salud, inclusive lo que tiene que ver con el tratamiento de HIV. Digamos, es una situación, como decía antes, que nos encontró, bueno, con algunas herramientas, pero otras herramientas que tuvimos que construir a lo largo de todo el año anterior. Bueno, sí les quería contar que como, digamos, algo que sirvió mucho fue contar con un ministerio específico. Ustedes saben que desde diciembre de 2019 en Argentina hay un Ministerio de Mujeres, Géneros y Diversidad. Este ministerio está enfocado en tener políticas específicas para el colectivo LGBTI, y esa jerarquización también, digamos, implicó que hubiera decretos y medidas legislativas y medidas, en realidad medidas de gobierno, de políticas públicas que fueran orientadas específicamente a las personas LGBTI. Y otra cuestión que también quería señalar respecto a esto que mencionaba sobre las particularidades de Argentina, es que Argentina es un estado federal. Entonces hay muchas medidas que parecen ser mucho más fáciles de aplicar en las grandes ciudades, pero también el desafío está en cómo llegar a las provincias, algunas provincias en las cuales las personas LGBTI no se sienten tan bien, digamos, recibidas como en las grandes ciudades, como pasa en muchos países, porque hay cuestiones culturales de por medio, pero también a sectores muy vulnerables que están excluidos en un marco ya de pobreza anterior, digamos, a la pandemia. Sí, como medidas alimentarias, y después paso como al gran tema que yo sé que Julie quiere escuchar, que es el cupo trans. Sí, como medidas de asistencia, digamos, los planes sociales que se dieron, por supuesto que tuvieron acceso a las personas LGBTI, pero específicamente se creó un ingreso extraordinario de emergencia, y en lo que tiene que ver con la asignación universal por hijo o hija, que muchas personas también LGBTI las reciben, porque son jefes y jefas de familia, es una asignación que recibe toda persona que tiene hijos menores de edad, a cambio de que sus hijos o hijas vayan a la escuela y reciban sus vacunas correspondientes. También recibieron esta ayuda alimentaria, que sabemos que por supuesto que no es suficiente, pero que es una gran ayuda. Y ahora quería, contar en lo que se refiere al cupo trans. El cupo trans, ustedes saben que en algunas provincias del interior del país, sobre todo en la provincia de Buenos Aires, ya existía un cupo trans en algunos poderes del Estado. Pero esto, a partir de un decreto que dictó el presidente Alberto Fernández, se estableció un cupo trans para que todas las personas travestis y transgénero, transexuales y transgénero, pudieran trabajar en la administración pública. Crea un cupo de un 1% para un sector que ha estado históricamente fuera del mercado laboral, que además, por diversas cuestiones, le ha sido muy difícil concluir sus estudios, porque si ustedes toman una radiografía, inclusive tomando informes de la Comisión Interamericana de Derechos Humanos, habla de que tiene una esperanza de vida del 35%, justamente tiene que ver con esta exclusión y la forma también, a todos los peligros a los que se encuentran a partir de la exclusión expuestos y expuestas. Y en base a los compromisos internacionales, el gobierno argentino decidió que era un momento para poder, de alguna forma, establecer un cambio, no solamente un cambio estructural en la vida de las personas trans, pero también un cambio cultural. Y quería contar esto del cambio cultural porque también esto genera que al interior del Estado se conviva con cuestiones que están en la legislación. Esto es, las personas LGBTI cuentan con la identidad de género, pero después en la práctica hay cuestiones, hay como un gap en la práctica, y que hace con tener que, bueno, cómo ponemos en marcha, cómo las incluimos, cómo pueden trabajar, cómo pueden ejercer su derecho al trabajo, a la alimentación, etc. Entonces, básicamente el cupo trans es un cupo, como les decía, que bueno, pone un número de un porcentaje del 1%, el 1% tiene que estar, digamos, cada agencia del Estado tiene que tener un 1%, digamos, lo que, por supuesto, no pide que hayan terminado sus estudios, porque ese era un problema que teníamos, digo, si no es un círculo vicioso, porque si ponemos el cupo trans y las personas están excluidas, ¿cómo acceden al trabajo? Entonces no tienen que tener sus estudios terminados, pero a cambio sí tienen que comprometerse a terminar sus estudios y el Estado tiene que darle facilidades para poder hacerlo. El objetivo principal de esto es romper con la cadena de exclusión y romper con una cadena de desigualdad, como les decía, que es histórica, no solamente en Argentina, sino creo que en muchas partes del mundo respecto a las personas trans. Bueno, en este momento estamos, por lo menos acá en el Ministerio, tratando de llevarlo adelante. Tiene toda una serie de pasos. Para empezar, las personas trans que estén interesadas tienen que inscribirse en una especie de bolsa de trabajo, y cuando se genera una vacante, esa persona, bueno, es entrevistada, etcétera, pero no se le impide poder entrar a trabajar si no tiene las mismas calificaciones. O sea, tiene por supuesto que tener idoneidad para el puesto, pero no se le pide las calificaciones que se le pide al resto digamos, de la gente que ingresa, porque como les decía, no han tenido en muchos casos posibilidades de estudiar. Sorprendentemente, porque yo estuve con las entrevistas para acá, para el Ministerio, que estamos pensando en unas más o menos 15 personas, que sería el 1%, los currículums que nos han mandado son sorprendentemente buenos, así que estamos en este momento justamente tratando de poder cumplir con el cupo a la brevedad, y después tendríamos que ver cómo hacerlo para todas nuestras sedes en el exterior también. Así que bueno, esas son las principales medidas. Quedo a disposición para las consultas que tengan, y de nuevo un placer estar aquí. Saludo a todos los y las participantes. Muchas gracias.
Thank you, Cecilia. We'll come back to some of the points you just raised. That was really very interesting and helpful. Cheryl, I wanted to bring you in at this point. The Canadian government as well, over the last couple of years, have begun to implement some very important new policies and foreign assistance dedicated to LGBTQI communities around the world. Would you like to start to tell us a little bit about this new funding and how you guys have adjusted because of the unexpected global pandemic?
Yes, thank you so much, Julie. It's a real pleasure. First, let me say that thank you very much for this event. I think it's a great opportunity and for inviting Canada. This is an issue that the government of Canada is deeply committed to. And we are interested in helping with the promotion and protection of human rights of LGBTQ2I persons around the world and in Canada. And an important way for us to do that is to work alongside advocates and civil society organizations. So this event is really fantastic. And it's great for me to have the opportunity to talk about some of our programming. This is something we're proud of and that we're working hard on. We have been. So in 2019, the government of Canada announced $30 million in dedicated international assistance funding over 5 years. And that's followed by $10 million per year thereafter to support Canadian and local partners working with LGBTQ2I communities in developing countries. The way that this program is designed is that there are 3 programming windows. So I'll describe each one of those. The first is a $10 million program window called the Canadian Partnerships window. And that is really focused around supporting Canadian organizations who are working to advance the human rights of LGBTQ2I peoples in developing countries. The second window is what we call the geographic programs window. It's $15 million. And that will support local and regional organizations in developing countries. And they are, and the idea here is to support grassroots projects that are addressing the priorities of the communities. And then finally, we have what's called the Global Partnerships window. That's a smaller window, $5 million. And the idea behind this window is to support global initiatives that are helping developing countries. And it's related to policy, advocacy, research efforts, for example. Another key point about this programming is that this is designed through a human rights-based approach and an inclusive approach. So here the emphasis is on a participatory process, meaningful engagement with Canadian civil society organizations, with local and regional and international partners, so that this is a very informed program. And the idea is that we want to make sure that this is responsive to the perspectives and the realities of LGBTQ2I persons and representative organizations in developing countries. So COVID-19, this has had a big impact. We're very aware of that. And so we've spent a lot of the past year engaged in discussions and dialogue in order for us to learn from stakeholders about what's their perspective so that we can gain a better understanding about what the impacts of COVID-19 have been and what does that mean for Government of Canada programming and policies. Our Minister for International Development in May of 2020 held a roundtable specifically on this issue, and it was also just specifically to discuss the how international assistance in the context of COVID can be responsive to LGBTQ2I issues. What we do know, and this is right across the board and we're seeing it everywhere, is that in general, the pandemic is having a disproportionate impact on the most vulnerable and marginalized communities within the world. And that includes LGBTQ2I people. It's affecting access to healthcare, it's threatening livelihoods, it's also impacting safety and security. So some of our key takeaways from that is that our programming needs to be flexible and we need to encourage sustainability when we're providing funding. I'll just provide a couple of examples of some of our projects to show how it is being responsive. So one is through our partnerships window. We're providing $500,000 to Outright Action International, and they are doing global research and advocacy programs. And that is including COVID-19 Global LGBTQ. They have a fund, a COVID-19 Global LGBTI Emergency Fund. Also through the multi-donor Global LGBTI Human Rights Initiative, the GHRI, which is providing response grants to individuals and organizations in the COVID crisis. And then finally, I'll mention through our partnerships window, we are supporting the Act Together for Inclusion Fund, and that has launched its first call for proposals and is working closely with a table of international advisors. And those international advisors are providing advice and insights regarding specifically pandemic-related needs. So we're leveraging every opportunity we can, including this one today, where we're having a discussion with other organization and community members so that we can see how our response needs to be adjusted and responsive. So maybe I'll leave it there for now.
Thank you. Let's stick with Cecilia and Cheryl, and then I'll bring in Midnight and Pepe shortly. But thank you for that, for starting that off. I'm curious, when you watched the Global Philanthropy Project's presentation, and we look kind of bigger systemically at the minimal response from the more formal global humanitarian organizations and money flows, that so little managed to actually trickle down to LGBTI projects and communities specifically. I'm curious if you have thoughts about how we can shift that reality. Both of the examples you gave, and there's many more, and there's other governments on this call who really care deeply about reaching the LGBT communities, are, we're still having a, kind of limited systemic change to the overall flows of development money. And I'm just curious if we can think about how we can use the experience of this pandemic to make further systemic change in this space. I think we've all heard about how we're not actually going to go back to the way things used to be. We're creating a new normal all over the place in terms of workplace environments and other ways in particular of addressing inequalities. What are some of the other, lessons learned so far from each of your experiences? And after we're done with the panel, we'll bring in other governments who might have more to say about their experience of really creating a more LGBT inclusive economic development programs and other other ways of genuinely including within development priorities, especially humanitarian assistance. So actually either of you can start to muse on that question.
Bueno, puedo empezar yo si quieren. Bueno, creo que está bien. ¿Qué experiencia podemos tomar de la pandemia para poder dejar asentadas bases para que las comunidades LGBTI puedan contar con herramientas a futuro? Me parece que, por lo menos, insisto, yo hablo desde Argentina, un país del sur global, que tenemos un montón de desafíos, que peleamos con esos desafíos, porque por ahí, cuando escucho muchas veces muchas medidas que toman algunos países, me pasa que pienso para adentro y digo, qué buenas medidas, pero para nosotros nos falta todavía resolver muchas otras cuestiones, y que tienen que ver con la interseccionalidad de muchas carencias y muchas necesidades que tienen las personas LGBTI. Es decir, en mi país muchas de las personas LGBTI no solamente sufren marginalización o vulnerabilidad por ser personas LGBTI, sino que muchas veces interseccionalizan con otras particularidades, y eso hace que tengamos que ser creativos y creativas en la solución. Me parece que primero pensar en institucionalizar algunas cuestiones. Creo que, por ejemplo, el cupo trans, que espero que sea ley en breve y no sea solamente un decreto, que el cupo trans va a ayudar mucho en esto. Me parece que hay muchas cuestiones a cambiar y a modificar y a ajustar para poder cambiar un patrón histórico de discriminación que han tenido las personas LGBTI. Por supuesto que la ley de identidad de género, la ley de matrimonio igualitario han sumado mucho, pero todavía hay muchos desafíos, inclusive la ley de salud mental, que va en línea con la despatologización de las personas LGBTI. Pero en primer lugar, pensar la interseccionalidad. En segundo lugar, pensar en la inclusión, pero la inclusión económica, y cómo llegar fuera de las grandes ciudades. Esto que les decía, antes de empezar esta charla, estaba leyendo un poco lo que hace una ONG que integra el core group de la Equal Service Coalition, que es con Urbanes, y todo el trabajo territorial que hace para poder integrar a personas LGBTI al interior de Buenos Aires. Que el interior de Buenos Aires no es la capital federal, porque cuando pensamos en Buenos Aires, la gente que conoce Buenos Aires ha venido, es muy lindo, tiene cosas, y dicen que parece Europa y todo, pero nos movemos 50 kilómetros o mucho menos, y las necesidades son otras. Las necesidades laborales, las necesidades alimentarias, las necesidades sociales. No es lo mismo ser, lo que decía al principio, una persona LGBTI en Buenos Aires que ser una persona LGBTI en alguna provincia, dependiendo qué provincia sea, o al interior de una villa de emergencia. Entonces, me parece que una villa de emergencia, que es un lugar donde hay necesidades que tienen que ver con necesidades habitacionales, necesidades de alimentación, desempleo, empleo informal. Me parece que un desafío es pensar en cómo dejar de pensar solo en el mainstream e ir a las particularidades que tiene, por lo menos, que tienen algunos países de Latinoamérica, porque es algo que compartimos con la pobreza estructural, es algo que compartimos lamentablemente con la mayoría de los países de Latinoamérica. Y después, sí, pensar, además de la institucionalidad, ser creativos. Pensar todo el tiempo cómo podemos hacer medidas, que hay muchas medidas que se pueden tomar y hacer y que no tienen tanto costo económico. Entonces, sí pensar en cómo visibilizar los derechos de las personas LGBTI, cómo mejorar y ajustar algunas cuestiones, y no pensarlos como grandes epopeyas a cambiar, sino como pequeños cambios que podemos hacer desde el Estado todo el tiempo y en nuestras prácticas continuas. Bueno, muchas gracias.
Cheryl, do you want to chime in?
Yeah, happy to. Thank you very much. I think this is a really interesting question and really important because for me, you know, I've talked a little bit about the what, but also even more important is the how. And I feel like this is a really important time in the world, but also for governments and for the government of Canada. It's an important time where I feel like we're doing a lot of growing and learning and we're evolving. And I'm really excited to see and to be under a policy frame, I think that allows that to happen. So what I would say about this is that while I've talked about dedicated funding, and dedicated funding is important, I think there's a more fundamental issue about how donors and how governments undertake international development. And that needs to be done right across the board, no matter what kind of programming, through an intersectional lens. And what I was saying earlier is that I think for us, that's enabled through our policy framework in the Government of Canada, the Feminist International Assistance Policy, because already under that policy, there was a philosophy behind it, right? There was already a focus on the poorest, most vulnerable, and the most marginalized. It's focused on empowerment. It's about helping people to claim their rights. It's about helping people to have their voices heard, making sure that nobody is left behind. That approach places gender equality and the promotion and protection of human rights at the heart of our efforts, but also it's really founded on the principle that all people must enjoy the same human rights, regardless of any aspect of their identity, regardless of their sexual orientation, gender identity, expression, and sex characteristics. So that is the philosophy framework, and then there is what we put into practice. And so that is, I think, really what's we're seeing within our department. We're starting to see the impact of having all of your programming, all of your international assistance projects, including humanitarian, be informed through a gender-based analysis plus and being informed through a human rights analysis. And I think that way of undertaking things, of making sure you do that analysis, is a way of helping to guide international engagement so that your programming and your policies are better able to serve LGBTQ2I communities. It's better able to contribute to communities. I mean, we need to understand when we're looking at issues about how different aspects of identity interact to compound discrimination or exclusion. We need to understand how, we need to make sure that lived experience is informing the design of development initiatives. And that's the way I think that we can have that reach. I would also say for our government and for our department, we are not only taking a look at our policies and our programmings and trying to make sure that they're informed and that they're responsive to human rights, but we're also looking internally at ourselves as an organization and making sure that we are doing a good enough job and looking at how we can improve being an organization that respects diversity and promotes inclusion. And so, for example, for my branch, the area, the sub-organization that I work in, I am the diversity and inclusion champion, and I'm working with a group of employees to see how are the ways in which we can make our workplace more safe. How can we make sure that we are promoting gender equality, diversity and inclusion in the workspace. So I'm excited by this. I think that this has the potential to put the voices of those who have historically been less represented to the forefront. Let's make that more the center of our thinking. I do believe that we've come a long way. I think that we're in an intensive period of this learning right now, but I also recognize that we have a long way to go. And so I'll end it there just because, again, I'm going to end it on the point that I appreciate discussions like this. This is a great learning opportunity for the Government of Canada. And I think it's through exchanges and it's through dialogues that we grow.
Thank you. I really appreciate actually that both of you mentioned your own inclusion and diversity in your own workplaces, and the hiring of trans people in the Ministry of Foreign Affairs and your diversity work, because this is really about people's livelihoods ultimately and being able to function. So I really appreciate you bringing that piece in, and the and both of your reminders about the need for greater intersectional thinking in development programs. It's really, really important point, and we will get back. We have some great questions already, but I want to turn to Midnight and to Pepe and bring you guys into the conversation. Midnight, start with you. APCOM has been doing this incredible series on LGBTI communities and COVID, and really paying close attention to the response of the queer communities in the API region, both our vulnerabilities as well as the resiliences that are emanating. And I just would love for you to share a little bit about your big takeaways regarding how civil society has been responsive during the pandemic.
Thanks, Julie, and Sawadee krap, everyone from Bangkok. Thanks, Jessica, and also Stefano, and of course the Equal Rights Coalition Thematic Group on Donor Coordination for creating this space. I think this is really, really valuable, and it's really things that we need to discuss right now. With APCOM, what we've been doing since April last year, coming to one anniversary already, is really actively reaching out to our community across 30 countries in the Asia-Pacific region with over 200 community organizations. And the stories that we're collecting is really about ensuring that there is this body of evidence about how the communities are going through COVID-19. At that time, we didn't know how long it was going to be, and then we started this series on COVID-19. And actually, the latest issue was issued on the 1st of March, or on the Serial Discrimination Day, and then our next one will be on transgender men, about how they experience COVID-19, just to be launched in time for the International Transgender Day of Visibility at the end of the month. So it's about connecting stories, it's about sharing challenges, and it's also about sharing some inspiration about what's happening in different communities. We know that despite the pandemic, there's also some solutions, and also the resiliency of the community-based organizations that are able to not only to do their own work, but also actively outreach to the most vulnerable as well. So those issues are ongoing with the COVID-19 newsletter. We've also started to do the emergency funding that was launched last year called Corona Compassion, and we've already given out emergency funding to 15 community groups. And this is just from the communities putting our funding together and really helping the more vulnerable within our community, because they're not able to access emergency funding from within the country or even within the region of Asia Pacific, because as the GVP report says, there's a lot of the funders that are outside the Asia Pacific region, and so you need to apply to those emergency funding. And you need a bit of time to do that, or you need support to be able to do the application process, and of course be able to be already connected to the networks at the regional and global levels to be able to access those funding. And in terms of the lockdowns period, we developed some sets of, it sounds really trivial, but the protocols, because it was so different to what we normally do in terms of emergencies. So we developed these emergency protocols on how to conduct themselves, and also if you are a community-based organization that provides HIV services, how to also ensure that the clients are coming to your clinics will also be protected against COVID-19 with the PPE, sanitizers, and also to how they would need to be able to change the way that they work internally with their staff, looking after their safety, and working from home. So those protocols we were able to develop and share that with our community groups, so they don't need to think of another one. They already know this is something that they could also apply and adapt at the local levels to ensure that the safeguard of their staff and also their clients. And we also realized that, all our community organization stories, we have to kind of like package this in a way that they will also be able to kind of like talk about the issues at the regional level and also send a message to the kind of duty bearers. And last year we gathered 70 signatories and sent a letter to WHO in relation to LGBTQI communities around issues of lockdowns in countries that LGBT are more vulnerable because of criminalization laws or because of police abuse and arbitrary arrest and detention related to restriction of movements. And these are things that the stories also can be packaged for advocacy, because if we don't do this, then we cannot rely on just the media to help us collect those stories and put our stories out there. So the community is really important to be able to show to light the human rights abuses that they are experiencing, or the inequity of access to emergency needs. And now, because of the prolonged COVID-19 pandemics, it's about the livelihoods of the people. So the main takeaways from APCOM, I would say, three things. We need a community-led and community-owned funding mechanism in the region. So without this mechanism, with other emergencies that's happening, we will still rely on external, outside, international, global donors to be able to kind of like funnel funding to community-based organizations. And organizations don't have reserve fundings for their staff or flexible funding to be able to do the emergencies that's required by the communities on the ground. At the GPP reports, I mean, a lot of those donors are already working on human rights issues, and the flexibility is much more available. But on other projects that is looking at more service delivery, the flexibility is not really there. So it depends on the organizations to be able to negotiate, and depending on how flexible in terms of the approval process is, and that can take a long time. Secondly, the importance of LGBTQI civil society in Asia Pacific. We know that the most vulnerable marginalized groups are being reached out through community-based organizations and help highlight the inequity, the access to services, human rights issues, and also being resourceful to the communities to do the emergency humanitarian support. So without that, who is going to be then really reaching the most marginalized and LGBT community organizations? So the issues around sustainability is really coming to light now about hopefully there won't be a reduction in ODA, but we already see that the trend is about countries looking after their own population and their own needs. How would that affect in terms of the global solidarity and the 2030 leaving no one behind strategies? And then lastly, mental health issues. There's a lot of stigma within talking about mental health in Asia Pacific, but COVID-19 has really opened up discussion about this a lot more, particularly within LGBT communities and also in their leadership as well. So how are we trying to implement projects? How are we still trying to do something different and new? And that means, a lot more efforts to get to grasp with, but also dealing with our personal issues at the same time as well. So there is this gap about mental health mental health programming for community-based organizations and also for the leaders in the organization. And so we really urgently need to really address that, not just talk about it. Thank you.
Thank you, Midnight. That was a great compilation of your lessons learned from the region. And let's come back to you and with some more questions in a moment. Pepe, I'd love to bring you in. Great to see you. Thanks for joining us. We all, I think, early in the pandemic heard and saw the news about the incredible, crackdown rather on the LGBT community, and in particular, the arrest of those 20 LGBTI youth in the homeless shelter. Uganda isn't the only authoritarian regime country that abused the COVID moment to crack down on unpopular communities or to ram through laws against trans people and other things. But tell us a little bit about what it was like or is like to have civil society further curtailed during COVID, and what are some of the ways that you in Uganda and SMUG have been responding to that.
All right, thank you so much, Julie. Thank you, Stefano, for reaching out to make sure that I'm part of this discussion today. And to every delegate or participant on this call today, it's good that you're here, but also I'm honored that you're able to listen to a perspective from Uganda. In response to that question, yes, during it's basically 1 year anniversary this month, which really not celebrated, but it kind of brought back, you know, the fear and the trauma when our colleagues were arrested, which was purely, of course, homophobia, but then the COVID rules, guidelines, the presidential guidelines were the ones that they were accused for and charged with and incarcerated or detained for about 55 days. Well, the guidelines themselves from a human rights perspective, you'd say that they, as much as they were placed for controlling the spread of COVID, they in themselves were also abusing, you know, human rights of citizens. For instance, women could not go to the hospital. There were reports of women giving birth by the roadside because they could not access hospitals. There was police brutality and so on for the general community. But then when it comes to our community, the LGBTIQ community, we were further pressed down. Already we work in a very highly criminalized environment, and we are in a dictatorship as well. So, and you know that we've had an election just in January. So we kind of have two things going on at the same time. So with COVID, our community members, especially because we have programs on HIV and AIDS, we have research programs, we have outreaches and so on, because of lack of movement. And we tried really to apply for a sticker on one of the cars so that we're able to reach out to our community and to be able to take maybe food or medicines, or even have like, because we have mental health programs where some are done in groups. So we were really unable to do any of those things. And because also communication for us, there are like several things. We have a law on communication inception. So like, I'm sorry, there's like lots of things, plus the trauma that we went through in March is all like coming back to me. But the pandemic really affected us, so to say, like maybe threefold. We were unable to visit people who had, you know, crisis. We have a program called the REACT, or Rights Evidence Action Project, where we support people with shelter. We support them with food, with medicine, psychosocial, family mediation. All these were put at a hold. And the funding that we had at the time, of course, we have to communicate to our funders, whether we can channel it elsewhere. Things like airtime was really difficult to purchase. Internet was also really difficult for us to, you know, navigate. So at some point we were really stuck. I had to buy a bicycle myself to be able to at least reach out to members of my community within my area, which is about like 10 kilometers apart or 5 kilometers, some like 20. And then we had to like hire, you know, a friendly police officer who would accompany us with a car to like distribute the medicines to people whose medicines were, you know, they were due for a refill from the hospital. But we also saw that there was arbitrary arrests because most people knew that, you know, there's no police station you're going to go to. And already in our community, it's very difficult for our members to even go to the police to report, because they are the #1 perpetrators of violence towards LGBTIQ persons in this country. The other thing is that evictions also happened during this period, which forced many people to go either home to their homophobic families or live with partners who were either violent to them. And we do capture all this information in a report that we released in December 2020. We did a rapid assessment of what the conditions are during the pandemic, just taking account, end of February to November. And lots of issues really came up. Intimate partner violence, denial of food, evictions, denial of medicines, transportation, of course, was really difficult. And it just, everything was just like worse for LGBT community, while the rest of the other communities were in a way able to access, and particularly around the case of the 20 youth who were arrested, we kept on trying to engage the government. They blocked lawyers, they blocked counselors, they literally blocked everybody who was able to go to the police station or the prison where they were held. But eventually they were released, and right now, since they were released, the trauma that they suffered, I can for sure say that none of them is if I can put it in percentage, they are showing maybe like 30% progress with the psychosocial support that they are getting, the counseling that they are getting. And the counseling is a bit limited because of funding, because of also attitudes. There are very few counselors or psychologists who are willing, to basically listen to them or to even administer any form of care to them. So together as civil society organizations, COVID itself, the pandemic also kind of divided civil society, because everyone was kind of taking care of their own, but also the mental health aspect of, or impact on just general human rights defenders became something that was very visible, that when you called on someone that you thought would actually come in and support you immediately, they wouldn't, even if they were like close to you, if they're your neighbors and stuff, because everyone was going through and is still going through their own kind of, effects from the COVID pandemic. Maybe I can stop there for now, and I can, continue when another chance is given.
Well, I mean, I would like to, ask both you and Midnight, specifically since this is a presentation or an event that's with government funders and government representatives, as well as multilateral entities on today's call. Pepe in particular, I mean, that was, yet another dramatic, scary, traumatic moment for you all early in the pandemic. But, what is the most, it's been a year, as you said, like, what are some of the most helpful ways that the LGBT friendly governments and multilateral institutions can, be of support? I mean, we've talked a bunch about the types of funding, and we'll get back to that, but, both the emergency as well as the longer term engagement, how, what are the most useful things that governments can do that want to be helpful? And Midnight, as we're speaking to governments and thinking about our requests, given your long experience on HIV issues and access to medication, I'm curious if you have some thoughts to share about vaccine access and LGBTI communities in your region or globally. Just being mindful of who's on this call today, and bringing in civil society's both perspective as well as our direct requests of government. So Pepe and Midnight, either of you are welcome to respond to that.
Okay, Midnight, let me go first. Just in addition to what I'd spoken about before, I want to tie that conversation into the elections that happened during the pandemic itself. We're talking about the new normal, but the new normal, which is digital. And during our elections, our internet was shut down completely. Yeah. And Julie, Stefano, you've been trying to reach out to me and not finding me because I have to, sometimes data just goes without you even connecting. So there's difficulty in that. So I really don't know about what this new normal is really going to look like because you have to either buy VPN, you have to choose. VPN is a bit expensive. Would you rather, eat or buy VPN so that you're able to communicate? So it's really a difficult thing to navigate. And tying into the elections as well, the crackdown is still going on. Some of you have read that the opposition leader was tied to the LGBT community. And as I speak, since this year began, we've hardly gone to our office premises. We work mostly virtually or have to meet somewhere else because our office has been under very heavy surveillance. As I also speak, I do not have my passport. It's held by the state. Yeah, so the crackdown is still, continuing, and yet the pandemic is still present. So what should governments, what should our, our supporters here do? I think Cheryl spoke about it, and maybe Midnight, about, direct and flexible funding is very, very important. When you're funding development programs in our countries, you need to, to bring us in to discuss some of the ways that we can be part of that development, because our country cannot develop without its citizenry. So it's not just the government working on its own. We are part of, the citizens. So we need to have a say, but also we need to have access to that kind of funding. And still also sticking to funding, there needs to be a way that donors fund, long-term instead of, project-based, and there needs to be a focus on core funding. Midnight mentioned mental health programming. SMAG has been doing this for quite a while, and we've seen the gains that we've made with the work that we've done around mental health. But you find that while we are doing this work, ourselves as the leaders in these organizations, we are running around like headless chicken without our own kind of support system. Our support system is reactive. It's just for the moment, and we can't even afford, places we could go for support because they're expensive. Where you can go and you're safe and someone really understands you is usually very expensive. When you go to places where it's maybe inexpensive, that's a place that you'll actually live with trauma because people are pointing fingers, or even the psychologists themselves, are abusing their own ethics and talking about the things that you've talked to them about. So not having salaries that can sustain, can pay your rent, can pay your medical bills, can, basically sustain you, makes this work even more difficult. And a lot of activists are actually either dropping dead or dropping out of activism because there's no way for them to basically sustain themselves and sustain their own movements. And when younger activists see this, activism is unsexy. They do not want to join it. And then you you see leaders staying, and you're like, ah, why is that one overstaying? You know, like for us now in Uganda, people will be like, oh, you're like your president. You actually do not want to be, but sort of even with succession plans, because leadership is not sexy anymore, people do not want to join it. So, you know, when we're thinking about funding, let's think about the models together with activists. And I'm actually really happy to be chosen on the advisory board for Dignity Network Canada. And we're beginning to have these conversations. The other issue is around diplomatic engagements with our governments. They are important. I know in the past, when we had the anti-homosexuality bill then act, there were some governments who were acting on the principle of do no harm, but do no harm sometimes does harm, right? So at every stage that government is engaging with our governments, engaging with our civil society, they should make sure that they involve us. We have to be part of those conversations. We have to be part of the table at all times. And I know that governments like to be, because either they don't have time or they don't have enough will or interest in the things that, in the work that we do, they tend to lump us as civil society organizations. And we, in our experience, we've experienced a lot of homophobia and transphobia from civil society itself, whereby some of us have either withdrawn from partnerships or withdrawn from projects, you know, just trying to keep our principle of non-discrimination, our values of equality, and just say, okay, maybe we'd rather stay broke. Maybe one day someone will see the impact of our work and will be able to support it, instead of us, you know, hanging out with civil society that inflicts, you know, trauma, continuous trauma on us. So we need to have those spaces where we can engage directly with governments that support our government. Then the other thing is staying in touch. I think I've already said this in the other points as well. Stay in touch with actual activists, the activists that are on the ground, who have lived experiences. And when we share our lived experiences, take them seriously. Yeah, the agenda comes from our lived experiences. When you come with your agenda, let's meet halfway and be able to, you know, to support each other in advancing human rights for all. And yeah, that's what I'll submit for now. Thank you so much.
Thank you. Midnight, do you want to chime in?
Oh yes, thanks Pepe for that. I think you've said a lot of what I was going to say anyway, but I'll more concentrate on the vaccines discussions, and also how that's related to the experience that we know from HIV in the region. You know, unfortunately, 2020 came, and then the targets for HIV in our region is not met, so that's been shifted to 2030. So in our region, over 40% of new HIV infections is amongst gay men and other sex with men. Only a quarter of gay men and other sex with men and people who inject drugs in the region, and less than half of the transgender people and female sex workers actually receive HIV prevention services that they need. And then in terms of the new medicine, we're talking about the exposure prophylaxis that is still limited in terms of the access. Some countries are, you know, afraid to use their TRIPS flexibility in terms of accessing cheaper drugs. And that's been issues for particularly people living with HIV. And when it came to lockdowns, that was one of the issues around how do they still access the HIV medicine from where they are, particularly when they're in lockdowns. And the shift within what happened within COVID-19 was that then the communities were the ones who actually shifted their services quite quickly to reach these harder to reach populations and link them to services, because that's their population. They have to do something, you know, they have to be the one who's creative, much better able to reach than the facilities and governments themselves in terms of linking. So that is when the you know, in terms of the service provision and the need to have community-based organizations to outreach to LGBT communities and also link them to services that's friendly and also acceptable by the community themselves as well. That is a kind of model that within APCOM we want to see a lot more of, you know, these replications of community-led models, where it's community peer-to-peer reaching the peers themselves to communities that are marginalized, criminalized, and, you know, stigmatized. So within COVID-19, like with the vaccines discussions, how do we then integrate these community services into the systems for health at the country level? And how do we ensure that communities that are working at the front line, you know, reaching these harder to reach populations can also receive vaccines? And how is that going to be distributed equitably? But we know from the COVID-19, even from now, the vaccines have been discussed at the more, you know, global north. You know, I don't know how long we have to wait in the global south before, you know, we get to have those discussions about the inequitable of access. You know, we see that in the US already, that discussions about, you know, ethnic minorities, Black and Brown people within our communities in the region. That discussion is starting to have in terms of, yeah, is the vaccine coming? Who is getting it first? And then are we as a community working on the ground will actually get to talk about how this is being distributed at the country, or is this being discussed at a more higher level, and we don't have the space to even talk about what should be the distribution of vaccines. So we're hoping to be able to kind of like have those more discussions within the communities in Asia Pacific. But coming back into the discussion about you know, what do we need in the region? It's such about institutionalization, institutional building, the community-based ones. So within that, you know, Pepe talked about a lot of it already around, you know, flexible funding, around core funding, but it's actually just more than that. It's actually about really recognizing the value of the communities on the ground, and why do we need to actually bring up that as an institution to ensure that, you know, human rights LGBT will be upheld. There is a monitoring mechanism at country level that looks at, you know, how different programs, projects, or how governments are rolling out different services. How is it not reaching the communities that are working on LGBT organizations? Because without them, then it can be easily ignored. It can be easily forgotten. So I think if there is that value that you know, donors already know, that already want to support, then the support will come for supporting not just the institution itself. So Pepe talked about the people within institutions as well. They want to, you know, we want to be able to grow new leaderships. I've been with APCOM coming up to 10 years already, and I think, oh my gosh, have I outstayed where I am, you know? And if there's anybody else who actually wants to do this work, because it takes a lot of toll on your personal life, definitely. And it's a lot of work, like, you know, I have to do this call at night, and there's a lot of nights that we have to do this as part of our work, because we need to be able to show that you know, there are issues within our regions, and we realize that this space is really important for us to voice that for our communities, because not everyone has this privilege to be able to be on these calls, to be able to speak directly to donors. And as Pepe said, you know, it's actually about having that genuine partnerships and listening to us, and then take action on what we say. You know, I think that would be the message that I like to give. Thanks.
Thank you all. I'm mindful we have about 15 minutes left, and we already have a plethora of excellent questions coming from our audience. I have more questions, but let's try to do this by taking a couple rounds of questions, and then any of you can just select one or two to briefly respond to, and let's just see how much we can get in our last 15 minutes. Maybe I will read a couple that have come in so far from the from our audience. And I also want to encourage any of the other government or multilateral donors who are on the call to, if you have thoughts that you would like to share, please use the raise hand function. I think that should work. To share any other best practices around the questions around more genuinely inclusive development, would love to get your thoughts out there as well. It looks like we actually have a few people who are going to do live questions. Why don't we maybe start with that, and then I'll add to it, and then we'll take answers. Miluska, can you take yourself off mute? We'll take your question first.
Hola, ¿cómo están? Muchas gracias. Les saluda Miluska Luzquiño, directora ejecutiva de Trans Organización Feminista. En realidad, la COVID ha evidenciado una situación de exclusión y de pobreza, situación que veníamos reclamando históricamente los países latinoamericanos frente al reconocimiento de la identidad de género. En el caso de Perú, el pico y género fue bastante agresivo. Pudimos registrar hasta 17 casos de violencia contra personas trans y de género no binario. Casos de violencia que iban desde detenciones arbitrarias, detención de DNI, maltrato físico, psicológico y sobre todo una respuesta nula de parte de los sistemas que deberían de cuidar a las personas trans en ese contexto. La pandemia también ha resultado muy impactante en el tema de la crisis alimentaria y sanitaria, el desabastecimiento en los hospitales de retrovirales, atención periódica inmediata y asimismo la asistencia humanitaria de parte del gobierno a través de sus programas sociales ha sido nula. Por ello, las organizaciones de sociedad civil han apelado a la respuesta solidaria y voluntaria de otras organizaciones aliadas, feministas, LGTB, de mujeres, para responder solidariamente a la pandemia. Es una situación que se ha desbordado y que ha evidenciado la necesidad urgente de tener un proyecto de ley de identidad de género aprobada. En el 2016, junto a Synergi, presentamos la iniciativa legislativa que hoy está siendo debatida en el Congreso para tener un dictamen. Frente a ello, el avance de los antiderechos también ha constituido una barrera importante para poder acceder a derechos fundamentales como personas trans. Estamos viviendo un contexto de violencia y de exclusión. En el año 2020 fueron 5 los transfeminicidios o crímenes de odio que se vivieron en Perú. Hasta la fecha no hay justicia y 17 los casos de violencia contra personas trans y de género no binario en el marco de pico y género. Es necesario desde sociedad civil seguir promoviendo políticas públicas para el reconocimiento de la identidad de género, para el acceso a derechos fundamentales, para el acceso a servicios de salud cálidos, sin discriminación, y sobre todo ahora para acceder a la vacuna segura, informada y gratuita, y de esta forma eliminar la brecha de mortandad que está tan marcada desde los tiempos del VIH en nuestra población. Muchas gracias.
Thank you for that. A lot to chew on. Phil, you want to take yourself off mute? I think you had a thought to share. Thanks.
Hi, yes, thanks. I'll be really quick. It's more of an intervention that I'd like to propose, but it's really important to say that the field of economic development can be doing so much more for LGBTI people everywhere. When I say economic development, really, I mean the multilateral development banks. So for example, that's the World Bank, who actually has an LGBTI portfolio, but it's also the regional development banks like the Asian Development Bank, the African Development Bank. Why is this important? Well, I think COVID-19 has showed us, among many other issues, that poverty is a significant challenge for the LGBTI community and has pushed many on the poverty line into a situational poverty with little hope of escape. And actively getting them out of that situation requires so much more than flipping a switch. would I and many argue is that the multilateral development banks do this quite effectively for the general population. And very interestingly, the same multilateral development banks have a growing LGBTI portfolio, as well as mandates against SOGS discrimination. But for us on this call, as external stakeholders, we have to ask, is this enough? Are those mandates translating into robust engagement as well as resources? And to be blunt, no, I don't think it is. We could be there someday, but we're not right now. For example, the GPP estimates that the World Bank has funded $2.2 million in 2-year time frame to global LGBTI issues, which might sound like a start because it's only just a start. To give that some context, the World Bank Group committed $77 billion across the institutions in 2019 alone. So 2.2 million within 77 billion is just a drop in the bucket. This is not to criticize those pre-existing entry points. This is rather to say, how do we come together to build much more inclusive portfolios? How do we do this better? I give 2 quick interventions real quick to consider. The first is for organizations on this call. Let's start to really invest in education and awareness of what these development banks do and to build into those entry points. I know that they can be quite hard to understand and interact with. So Micro Rainbow International and I have developed a World Bank guide for LGBTI civil society organizations. It comes out very soon. We have a webinar next month. The second intervention is for, of course, governments. You occupy such unique positions of power on the executive board of directors in these MDBs. I can't underestimate that power. I echo the sentiment of our colleague Cheryl Urban when she says, in the humanitarian sector, let's make diagnostics much more inclusive and intersectional, but it goes beyond diagnostics. This goes to a question of political will. Are we willing to apply the political will to these multilateral institutions, to these public institutions, so that we can retire from an exclusionary status quo of economic development to one that is actually inclusive? Thank you so much.
Well, we have a lot of questions that have come through the chat. Thank you, Phil and Miluska, for joining us. It looks like we have Mike Babcock on as well from the UK government. Let's get to Mike in just a second, but maybe we can start with any responses so far from any of the panelists to the 2 interventions that we just heard from.
I can respond if you'd like. This is such a great conversation. Thank you. And there's actually so much that I want to say, but I'll keep it really brief because I don't think we've got a lot of time. But these points are very well taken, and we're absorbing this. Just to the most recent comment about the international financial institutions and our roles of governments like Canada. We take that very seriously, and we hear you. I think that this is a time because of COVID where these banks are coming together more frequently than ever before. And they're also looking at recapitalizations. They're looking at their concessional windows. And so in those discussions, those are opportunities for governments to say something and to make sure that we can push for an agenda that includes diversity. And I talked a lot about our feminist international assistance policy. But governments, like for us, our foreign policy is a feminist foreign policy. So we have different arms and different ways that we can go about doing this. So to get to the issue around justice, around violence, the government of Canada has many different ways in which it's trying to address this issue. Yes, one of them is through international assistance. But we also are very vocal on the world stage and through multilateral organizations, calling things out and also working in issues around more generally governance and looking to support an improvement of justice and rule of law in countries. So I think that we work with human rights defenders on the ground through our missions, for example. So I think that we have to look at this very broadly at the whole toolkit that governments have. And just maybe finally, I'll also respond to Midnight and Pepe, because I heard them loud and clear about the need to support community-based grassroots organizations and to help them build and continue in a sustainable way. And so I do think that, this is a lot of input that we've heard, and we hope that through our programming, that's one of the things that we can achieve, is to help organizations to grow and to support those organizations so that they, at the community level, can continue to help. I'll leave my response there. Thank you.
Thank you. Can I invite Mike to come off mute? Thanks for joining us today.
Great, thank you. Thank you, everyone. I would just want to say how excellent this session has been. Very, very useful. I work for the Foreign Commonwealth and Development Office. We recognize the exceedingly challenging times for organizations, and I am specifically looking at how we can work with organizations to promote and protect LGBT rights and inclusion globally. Thank you.
Thank you. It looks like we have Caleb on, and you had also some excellent questions related to some of these themes. Caleb, do you want to pose your question? There you are.
Hello. So I want to know that I don't come from the school of excellent presentation or excellent contribution. I come from the school of excellent action on the ground. If it doesn't reach the ground, it doesn't mean nothing for the ordinary people who are experiencing violence. So I make a single question. While everybody is patting themselves on the back on resources, I wonder if the truth is to reduce or mitigate the impact of violence, donors and government alike, especially when the violence is not only at the community level or by family, but promoted by the state themselves. I also, that's an answer for anybody. What are they truly committed to? Because violence doesn't end because the project cycle ends in 2022. Violence is generational. Separately, I note Phil's point of data collection. But for a small country like Belize with barely 1.9 billion in GDP, I made a personal request from the World Bank to support research, LGBT research, and they deliberately put up barriers to prevent any research in LGBT. So I want to ask a very specific question to anybody who would answer. When we talk about data collection, when you talk about investment, please do not or examine how you can identify factors that reduce barrier to data collection in whatever resources you provide the state or whatever resources you're providing. Please recognize that goodwill is one thing. At the end of the day, the people on the ground require hard work and actual commitment to change, to the application of the theory of change. If you don't have the application of the theory of change, we're going to be stuck in these cycles of being everybody patting themselves on the back. Until I can stop the read and people don't have to worry about the violence on the ground, I am afraid I cannot be happy with just good, positive words, and I leave it there.
Thank you, Caleb. And really, there's quite a lot of discussion about both the safety and security needs, the ongoing safety and security needs, and also the mental health needs. I mean, this is really a strong theme today in the questions. Maybe I'll just read a couple. Sorry, from Zohair in Algeria. There actually had two questions. How will we integrate mental health into the action plans in the context of COVID? Because this is one of the most damaged aspects of the pandemic in the context for their community. And also, how do you mobilize embassies in order to have a local approach that takes into account the new context of COVID? There was a question from Robert Simon about, are the donors aware that Francophone countries are on the margins of the global movement and don't have access to international funding? There was another question. Oh, there were a couple comments and questions from Essie and Akudo both in Africa with LGBTIQ women's organizations, again, kind of underscoring the need for longer term sustainable support to both the organizations, but also the leaders. And some of the comments that Pepe made earlier about it's not looking so sexy to be a leader of some of these organizations and how much hard work it is. There's a number of other questions out there, but I guess I'd like to just ask the panelists for some final responses to any of these questions and any final thoughts in general as we get to the close of our session. And maybe we'll just do a round of starting with Pepe.
All right, thank you. Caleb, thank you so much for your submission, and that actually really touched my heart. When I was preparing to come on this webinar, those were some of the questions I was asking myself. I'm like, okay, we are doing these webinars, we are talking to different governments, we are talking to donors, we are talking to international partners, but the violence is not ending. What are we doing wrong? Is it us who are doing something wrong? Is it, you know, asking those questions all the time? We've contemplated, you know, filing for decree for, you know, to overturn the law that is there right now. But every time we think it's the right time, it's never the right time, because very many people are, you know, they are homeless, they are nursing some wounds and so on. So when does the violence end? I really do not have an answer to that. But for us, for me particularly, I keep fighting every day to, you know, to occupy the spaces that I can occupy. And for opportunities like this, where we can actually talk to supporters of our government, supporters of our organizations, and, you know, speak to them frankly and say, okay, fine, your money is coming, but it's not sustainable for me. I'm doing this and I'm giving you reports, but my life is not changing. All things are not changing. So having honest conversations with, you know, with the people who fund us, but also who fund our governments is really important. So this space that has been provided is really important. And that's why when I was presenting, I talked about, it slipped my mind, but like when we talk, when we discuss agendas, do we stick to the things we agree about, or do our partners in the global north continue to do what they want to do? You know, sort of sugarcoat things that we told them and sort of say the time is not now, but when is the time? And that's why I was saying that we need to have those conversations. And when, you know, multilaterals are having those conversations, we have to be at the table. And it doesn't have to be for tokenism. It has to be that you're genuinely willing to change the things that are affecting us negatively, so that we can see the change that we want for our communities and globally as well. Thank you so much for the opportunity that I'm able to speak to people who have joined here today. I'll keep being safe, and thanks for the global solidarity.
Any of the other three? Cecilia, thanks.
Bueno, muchas gracias. Algo que decía Caleb tiene que ver un poco con lo que, digamos, yo dije en mi intervención, cómo llegar no solamente a, o sea, cómo llegar concretamente con acciones. Me parece que es un desafío que tenemos los gobiernos. Hay que empezar de a poco en el terreno, o sea, no solamente con principios, legislación y buenas intenciones, que es lo que decía Caleb, sobre todo buenas intenciones, sino que hacen falta muchas más cosas, hace falta acciones concretas, y quería agregar algo que es determinación política. Me parece que tiene que haber una determinación política de cambiar la situación y no permitir violencia contra personas LGBTI, que es algo que estuvo hablando también aquí. Bueno, creo que va a ser la última vez que intervenga. Quería agradecer muchísimo por esta invitación. Y bueno, para Argentina es muy importante también como parte de la Equal Rights Coalition y además por todos los foros donde interviene. Muchas gracias.
Would you like me to? Okay, so I'm going to try to respond to some of these things really super quickly because I think these are fantastic questions. Starting with our missions, our embassies that are around the world, you know, they are very involved in what we do. They establish good relationships. They know the countries that they're working in and have good relationships, for example, with human rights defenders. We have a Canada Fund for Local Initiatives that allows us to provide some support to organizations on the ground. But I would just say that we have to even move beyond that and start doing things differently. And not just work with the partners we know, but start, you know, get more informed by, for example, LGBTIQ regional organizations that can help us to broaden our networks. Mental health, absolutely. And just to reinforce that that is a critical part of the programming that we support. It's part of that recent call of proposals that I was talking about. In my previous job, when I was working on South America, I had the opportunity to be on the border of Colombia and Venezuela because we were providing humanitarian support for Venezuelan migrants. And I saw firsthand the psychosocial support that was being provided to some of these, including LGBTQI community members that were in that region. Absolutely essential. We're aware of the gap in assistance to Francophone countries. And so that's part of that back and forth that we're having. And we're getting input into where we should provide support and that we want to direct it to where there are gaps. And on data absolutely has to be a part. It's part of the how we do things. I hope that we're getting better. I agree that it's very important. And then just to end, I agree with all of the other participants and panelists that this has to be about more than words. It has to be about action. And we're committed to that. Thank you.
Yeah, and yeah, no, it's so nice to hear from Mike Babcock saying that the UK is looking to do more in this field because, you know, when we heard about the merger of FCO and DFID, I think immediately we think that that's going to be the less investment by LGBT globally. So I'm hoping to hear more from that. In terms of the work on the in the long run, I think it's about the livelihoods, right? Not just on the organizations that are working on LGBT issues on the ground. It's actually going to be their communities as well that have suffered because they are working in the informal sector, and they, you know, how will they gain the access to be more independent in terms of financial independence? So what Phil talked about in for the economic inclusion, how do we then integrate that for our communities outside the organizations themselves? I think that's something that we have to have a lot more discussions on, because or else then I think communities like ours was to be responsive to these needs, which will be more about the emergencies when actually it's not normal anymore. How do we then bring in those learnings to building something really new that's more inclusive, that's actually about being more flexible and looking at the needs of person as fully as possible rather than as, you know, one aspect of their life only. So thanks so much for this wonderful panel, and really happy to be part of this.
Okay, I'm going to give the last word to our two co-hosts, Jessica and Stefano, Synergi and DRL. Thank you again. Thank you for the fantastic conversation. I wish we had more time to dive in even more deeply, but this was a great 2 hours, and appreciate everyone's time. Jessica and Stefano.
Well, thank you, and let's do more of this. This was incredibly useful, and appreciate the over 100 participants today. Caleb, I really listened quite carefully to the points that you made, and Pepe and Midnight as well in particular, not just the sort of facts that go along with the concerns raised today, but the real lived experiences that this community faces. And that's something that we do take to heart, both in the US government and as part of the Global Equality Fund. So thank you for that reminder. And thank you all for these great suggestions and points made. And I look forward to speaking with you on a continual basis. Thanks. Over.
I want thank you, everybody. Thanks to the panelists, to Jessica as co-chair and Julie. Thank you very much for your moderation. Yes, as Jessica indicated, there is a great need, and many of the intervention, there is a great need for this conversation. I just want to highlight that we had almost 20 governments from the Equal Rights Coalition joining today, on top of the many civil society organizations. So clearly there is a need, as Jessica said at the beginning, and I extend this also as co-chair for civil society. Anybody who wants to join the working group on donors coordination from civil society also, as well as government, please reach out to Jessica and or I. And I think that particularly in this moment, this working group has an important role, and probably there is more than we need to unfold and to discuss, unwrap and to discuss. So we will look at ways in which we can retake these as a sort of like ongoing conversation within the working group. And thank you again. And we will make the recording of this video available so that it's there for people who couldn't join.
Okay, and with that, we will conclude, and we will see you all next time.